I'd like to, although I realise your focus is on boys, I'd like to sort of provide the context of what those boys will be growing up into. And actually many of the things that lead to men's worse health outcomes start in boyhood and childhood experience. And I'm sure that's something Natasha will be able to touch on as well. What is the picture with men's health today? So these are the most recent figures of what's called premature mortality by Public Health England. They define premature as under the age of 75. And essentially 2 in 5 men die prematurely in the UK today, versus about 1/4 of women. But we tend to use a slightly tighter definition. We look at 65, the historic level of retirement. And even today, 1 man in 5 doesn't make it to the age of retirement. And it's about 1 woman in 8 is the equivalent position. So those figures are for the 2019 ONS figures. And if you take the actual retirement age, it is 22%. It is genuinely 1 in 5 men are not making it to retirement age. And when you look at mortality over the life course, that is a picture that you see all the way through, really until you get to 80 plus, at which point you sort of run out of men. But before then, at every age group, men are dying more than women, and for a range of reasons. And it is an improving picture. There have been dramatic improvements in particularly in treatment of cardiovascular disease, which has had a big impact on increasing male life expectancy, although that has plateaued in the last few years. And so the improvement that was starting to be seen on a fairly continuous and consistent basis has come to an end. What causes that excess mortality? Well, if you look at what the biggest causes of death are at every age, overall it's heart disease, where 3/4 of the people who die under the age of 65 from heart disease are men. But if you look across the life course, amongst the youngest boys, causes of death relate to congenital chromosomal problems. Shockingly, from 5 through to 49, if you take those age bands, suicide is the #1 cause of male death. So mental health and men's mental health is an absolutely critical issue. From 50 to 80, then heart disease becomes still is the biggest cause of male death. And then from 80 plus, it's dementia and Alzheimer's. So that just gives a picture over the life course. But I think it's important to say, looking through the lens of boys, that a lot of the issues and problems that might evidence themselves later on in life through suicide, in many cases can be traced back to childhood experiences, and certainly not in all, but that is often an important factor. And here just confirms the awful picture on suicide. So again, these are actually the data in the bottom is wrong. The figures are more recent than that. And again, what you see at every age is that men are the majority of suicides. And it's important to note that it's often framed as a young man's issue, sometimes framed that way. In practice, when you look at it, it peaks amongst middle-aged men. One thing I haven't touched on is cancer. Now, rightly, you'll have heard that prostate cancer is the biggest male cancer killer. But it's the case that men are actually much more likely to die of all cancers. So these are all the cancers that men and women get, apart from breast cancer. And what it shows is that right across the board, men are more likely to die from most common cancers. Now, some of those, there's probably a linkage to alcohol, which again, men are 3/4 of the people who die from excess alcohol. And alcohol is also linked through to death from suicide as well. but there's a consistent picture. Breast cancer is a cancer that men and women both get, but the number of men who die from it is still thankfully quite small. So these are all the sort of cancers apart from breast cancer shown here. It's important also that it can often turn into a men versus women discussion, and that's not necessarily helpful. So if you have a look here, this is the life expectancy by deprivation decile, looking at the lowest level of deprivation and the highest deprivation. And there's a few things to observe. The first thing is that the difference between men and women is less than the difference between men and men in this particular case. So the life expectancy gap between men in prosperous areas and men in the least prosperous areas is about 9 years. And the equivalent gap between men and women is about 3 years, 3 or 4 years. And interestingly, the gap again gets bigger as you move into areas of greater deprivation. And in fact, there is a strong case in many factors in life that men are more unequal than women. You know, we have more of the billionaires. Most billionaires are men. Most people sleeping rough are men. Most people in prison are men. Most people dying from suicide are men. So we occupy both ends of the spectrum, and there is a bigger gap between men and men than there is between women. We often, I mean, earlier on, I showed a figure that showed that men effectively are 3 times more likely to die from suicide than women. But it's also the case that if I look at myself as a sort of a manager and in a charity, relatively well off in the grand scheme of things, I am 3 times somebody, a similar person to me, but working on a building site as a manual labourer is 3 times more likely to die from suicide than I am. So those differences are not just between men and women, they're also between men as well, men and men. And those inequalities between men are very important when considering men's health. Now, the classic that we always hear is, well, is it because men just don't go to the doctor? And there's a very interesting observation about that, and I'll come on to it again in a slightly different way. This is an old study now, 2013, showing about the consultation rate between men and women going to the GP. And what it shows is that in childhood, there's very little difference, mainly because the parents are responsible for the child going to the doctor. Then there's a lot of extra GP engagement between with women because of for reproductive reasons. And then as soon as you get towards retirement, actually there's no difference. And you see that consistently. If you look at the GP patient survey that's done every year, you will see big differences in GP attendance amongst working age men. And as soon as you get to retirees, there is no difference. And some of the things that you might think about, for example, men's higher rate of death from bowel cancer, for example, you go, well, is it because men present later and the disease is more advanced? And actually the evidence is the opposite, is men actually present earlier for bowel cancer. And there are often diseases where the sort of most people have it are men, and so it's better understood amongst men and sometimes picked up earlier amongst men. So it's not the GP attendance thing is an interesting phenomenon and less straightforward than it might look. And we've seen all the factors at work in men's health play out in COVID. Again, what we see here is that at every age group, men are more likely to die from COVID, much more likely. So across the board, they're between 70 and 100% more likely to die from COVID than women are. It's actually true for flu as well. So there are a lot of jokes are made about man flu. Men are actually more likely to die from flu than women. So man flu is, there's that actually touches on a way that traditional gender roles can sometimes be quite unhelpful. For example, in discouraging men, making out that it's unmanly to ask for help or to go and get help. One thing I would stress actually on the previous slide, talking about GP engagement, is the one area where men definitely use services less than women at all ages, including after retirement, is relating to mental health. But on the other hand, there was a useful and interesting study reported recently about whether men had been in touch with health services, with services who had then gone on to die from suicide. And it showed that the overwhelming majority had been. So again, that we need to be careful about the myth that men don't talk. And often there are reasons why men don't talk. You know, in the workplace, for example, showing weakness may be okay in certain enlightened employers, but that is not necessarily the case in all employers, and it may not be a culture where it's easy to do that. So across the board, we've seen men more likely to die from COVID. And that's partly down to biology. It's partly because men are more likely to be overweight. It's partly because men are much more likely to have diabetes than women do, including the negative consequences of diabetes, such as amputations and other such things. And it's true for all ages that men are more likely to die from COVID. And it's not something that's had a huge amount of attention. I was just checking the figures. 95% of doctors who died during the pandemic have been men. Only 55% of doctors as a whole are men. Similarly, 30% of nurses who've died during the pandemic are men, and only 10% of nurses are men, or 10 or 11%. And we get an interesting picture has just emerged. So interestingly, obviously the vaccination program is having a huge positive effect. And so one of the things we wanted to understand very early on was what's likely to happen with vaccination. And the research all the way through has been saying men are more likely to say, in the UK, men are more likely to say that they're going to get vaccinated. But what we'd seen with flu vaccination is they say it for that as well, but then they don't. And that is what is happening with vaccination at the moment. So all the research, men are saying they are going to get vaccinated, and they're not in quite the same levels. And this is something that is absolutely not being talked about at the moment in terms of exit from lockdown and everything that goes on. So the people who are more vulnerable to COVID, more likely to be hospitalized and more likely to die, are less likely to be vaccinated. Okay. Now, the NHS is aware of this and is working hard on it, but it's not got any public discussion at all. And these are the figures from last Thursday. So these are not out of date. This is what the picture looked like in England last Thursday. And it's a similar, not quite the same picture in Scotland, where the effect is very concentrated with younger men. But this is the picture in England for first vaccine uptake. And what you can see, 18 to 24-year-olds, 40% of men have had vaccination versus 47% of women, 49% 25 to 29 versus 55, and all the way up. And for dose 2, here again, the figures from last Thursday, 11% of 18 to 24-year-olds have had 2 doses, and 18% of girls in the same age group have had 2 doses. And this is the gender gap. It's just subtracting the 2 numbers from each other to show the percentage of the kind of the missing percentage of boys and or men rather in this case who have not been vaccinated. And except for reasons I don't fully understand, but the under 18-year-olds, what you're seeing is a consistent picture across the board, that both on the first vaccination and the second vaccination, that men are not being vaccinated. And what is driving that? Because in a way that brings up some very interesting issues to do with men's health. Sorry, this is just a reminder of what I was saying about, this is the current picture in terms of positivity of testing. So, and again, from the age of 20 upwards, it's showing that the positive test rate amongst men who are less likely to be vaccinated is much higher at the moment in community COVID testing. So those again are from last Thursday's figures. And what's the picture on that? Well, this is some research work that was done on the 9th, up until the 9th of June. And what it was showing, and this is the 2 sort of younger bands that I put in there because they were the ones of greatest interest. And what it's showing is that, yes, men are also saying they're less likely to be vaccinated, but it's because they haven't been offered it. There's no gap in, so one of the factors is they're less likely to have been offered a vaccination. And it's not entirely clear why that might be, but it's probably because they're less well known. They know the health system less well, and the health system knows them less well. And things like, you know, do they have an email address? Do they have a mobile number? All of those kind of things. The lack of relationship between men and the health system is coming back to bite us at this particular time. And so the NHS is looking at initiatives like going into workplaces, unbooked vaccination appointments, very important for people who don't know the system so well. And across here where you look, it says would be very or fairly likely to have a vaccine if offered. Again, men still here scoring more highly. And if you get to some of the attitudes in this survey, at least that sit behind it, some of it is a sense of chivalry, make sure that other people who need it more than me have got it first. Whereas with women, the gap has often been what you might call traditional forms of hesitancy. With men, there's a mixture of kind of complacency, which is I'm not at risk and therefore I don't need to bother. Sometimes ignorance. I don't know if it's going to work. So they're not thinking it doesn't work, they just don't know. And they may not know how to get it or know where to go. And that really ties through to, and COVID, but also ties through to a lot of the themes that we put in a document called the Men's Health Manifesto a while back, which tapped into what we've also seen in COVID. So the first thing we always say is measure and report. And you might be saying, well, of course they measure gender on everything and they report on it. Well, except they didn't. For ages at the beginning of the COVID pandemic, there were no gendered figures available. And we were having to use figures from other countries and digging out weird pictures from sort of obscure corners of the health system to find out what was going on gender. And it was similar for the picture with ethnic minority communities, where for a long time it just wasn't being reported, and so the problem was being missed. And we sometimes call ourselves the canary in the coal mine on health inequalities, because sex is always collected, and yet surprisingly little looked at and reported. And I think probably the fact that I suspect for many of you, that gender gap in vaccination is new to many of you, buried on page 55 of a weekly report produced by Public Health England, shows that, you know, sometimes poor issues of men's health are hiding in plain sight. So these are the main building blocks that we would argue for. Investing in research, obviously. Prevention, because men are more likely to drink, smoke, smoking less so, but drink and be overweight, for example. Designing services that reach out to men, because they won't necessarily automatically be coming into you. Looking at inequalities, looking at the men and boys at highest risk, and tailoring to those men and boys, because often services need to be different and the need to focus across the system. In other countries, now a tool that is being looked at to try and drive that kind of change is a men's health strategy. That's an illustration of the one in Australia and the one in Ireland. And of course, there's now a women's health strategy underway in England. And that's just a sort of a quick overview. Obviously, we're only touched the surface, but I hope that's useful, and I'll be happy to take any questions.